or supplies that would be in the hall. Wipe up any spills immediately. Encourage residents to use the corridor rails when ambulating. All healthcare facilities, regardless of whether the individual is in a hospital, in a CBRF or an assisted living facility or in a nursing home, all have corridor rails for their convenience. Provide adequate lighting both during the day and at night for patients. Turn on switches for patients to be able to see clearly in bathrooms before attempting to use it. If light bulbs have burned out, be certain that you get a hold of the maintenance department or assist in putting in new bulbs yourself. Check the residents' clothing for fit and safety. Loose shoes and loose shoelaces, any floor-length robes, and wide type of slacks all increase the incidence of falling. Have residents wear non-skid shoes or slippers for walking and transfers. Care for bathroom needs promptly. If a call light is put on and it's not attended to quickly because of the urgency that the patient is feeling, they may, out of desperation, get up and go to the bathroom unattended. Another thing that you can do is if a person has bowel and bladder problems, maybe it's best to just have a bedside commode for the patient or to have a bedpan or urinal right there at the bedside for their use. Stay close by residents using tubs or showers. Be sure that the grab bars next to toilets and the grab bars that are in the tub and shower area are secure. Ensure that walking aids such as wheelchairs and walkers are used properly and are in good repair. Be certain to remove footrests. Have them either swing away from the wheelchair or literally remove them before and after a person exits from that chair. Have personal items within reach of the resident. That means things like the call light, fresh water, their phone, possibly a purse for women. Want to have that close by, a Kleenex box, anything that's of importance to the individual, have so that they can reach it by extending their arm. And finally, have residents use eyeglasses and hearing aids as needed. Some residents are more likely to fall than others. These folks are called high-risk patients. Many facilities have fall risk assessment forms that help nurses score residents on their risk of falling. They do this on admission. When people are admitted to a facility, the nurse completes this fall risk assessment, and then he or she also completes this form periodically through the stay of the individual. It might be when there's a change in medication or a change in treatment or any other condition. There may need to be an update of this fall risk assessment. Residents who are at high risk for falling are those that are confused or have some other form of dementia, are over the age of 80, and this is thought because they're generally more weak and frail, and as a result are debilitated and much more susceptible to falling. Patients that have bowel and bladder problems that require frequent trips to the bathroom understandably are more at risk of falling. Those that have a history of falling within the last 6 months are more susceptible to falling again. Someone who has impaired senses, not only an impairment of vision, but also an impairment of hearing, it might be an impairment of their sense of touch, all predispose the person to falls. People that have gait and balance problems tend to stumble and run into things much more easily than others do. And those folks that are on certain medications, the medications that predispose someone to falling most commonly are sedatives, anti-seizure medications, narcotics, and all of these medications can cause dizziness and drowsiness, as does a medication such as a blood pressure pill that helps lower blood pressure. Ways for you, the caregiver, to help. For people that are at high risk of falling, it's probably a good idea to put them closer to the nurse's station. There's a lot of activity that usually happens around the nurse's station, and that means there are many watchful eyes to be aware of patients if they are close to the nurse's station. Set up a bathroom schedule to automatically toilet someone every 2 hours, every 3 hours, if there is frequency of urine and urgency that goes along with it. There are special pieces of equipment for use when there is a high risk for an individual to fall. There's much technology that's available now for your use. I'm going to just cover a few of the items, but know that there are many others, and you will probably see many others in the facility where you work. The first is a bed chair alarm. This is a pressure sensing device, and as a resident attempts to get out of bed or the chair, an alarm is sounded to alert the nursing staff that that has occurred. The second is a side rail wedge or side rail wedges. Usually they use multiple ones. They're used to remind a confused resident not to get out of bed without help. And it's also used to close the gap between divided side rails. A low bed. A low bed places the bed about 5 inches from the floor. Usually there is a mat that's on the floor right next to the bed. A bed cane is an attachment on the bed that provides support to the resident who's getting in and out of the bed. The most common and devastating injury resulting from falls is a hip fracture. More than 20%, that means 1 out of every 5 hip fracture victims, dies within the year. Another 20% spend the rest of their lives in nursing homes. These gel pants, as you're seeing now, are hip pads that cushion the hip joints and the long bones of the legs and help prevent injury when the patient does fall. A Wander Guard is an alarm bracelet worn by the resident that alerts the staff when a confused resident attempts to exit their unit where they're living. A Posy Grip is a material that's cut to the particular size that's wanted, and it's placed in a chair underneath the resident, and it grips to the clothing and prevents the individual from sliding down and out of the chair. The saddle cushion helps maintain posture and prevents residents from sliding down in the chair. If a fall occurs while you, the caregiver, are ambulating a resident, never try to stop the fall. It's just too easy for you to hurt your back by trying to hold the individual up. So it's better to allow the individual to rest against you, to lean against you, and you assume a wide base of support. That means your feet should be between 10, 12, 14 inches apart. And then lower yourself as well as the resident to the floor by sliding them down your body while protecting their head